Hello, my name is Jessica Eckhoff. I'm a graduate student at Eastern Kentucky University in the School of Baccalaureate and Graduate Nursing Studies. I'm a psychiatric and mental health nurse practitioner student. This video is an assignment for Nursing 892. My video accompanies a poster that I developed on the topic of increasing patient acceptance of long-acting injectable antipsychotic medications, or LAI. The poster describes a proposed intervention for educating patients on long-acting injectable with the desired outcome of reducing their refusal rates. Patients rapidly decline when they don't take their medication as prescribed. This is particularly the case with antipsychotic medications. When the severely mentally ill don't take their medications, they risk rehospitalization, run-ins with the police, dangerous behavior, and even injury and death. Increasing medication compliance is a goal for all providers, but it is particularly important for the SMI population. As the poster describes, research indicates that only 50% of patients prescribed an oral antipsychotic take their medication as prescribed. Using an LAI can increase medication adherence to 77%. This is a significant increase. Research also indicates that patients on an LAI have 36% fewer hospitalizations. Also, those using LAI enjoy lower overall healthcare costs. Prescribing an LAI for non-adherent patients is considered best practice. So the benefits are clear. LAI can often yield better health outcomes than oral antipsychotics, but prescribers report that patients often refuse. With all of these benefits, why then aren't patients using LAI more? That is the very question that this proposal seeks to answer. What barriers will patients report in their refusal to accept LAI? Can educating them regarding the LAI increase their acceptance and therefore increase their health outcome? The target population for this proposal is clients that are served by the ACT team in Northern Kentucky. ACT exists throughout the U.S. and in the English-speaking world and has been around since the 1970s when the goal was to get people out of institutions. ACT stands for Assertive Community Treatment, and it's a multidisciplinary treatment team that consists of case managers, peer support, therapists, nurses, and prescribers. ACT serves the severely mentally ill with the primary goal of keeping the patients out of institutionalization. I work on the ACT team in Northern Kentucky. These patients are particularly at risk due to the stressors of the major change in their life. Managing their own medications was probably not something that they have had to do for a very long time, and mismanagement of their medication was likely a contributing reason to their hospitalization or institutionalization in the first place. But they refuse LAI. The proposed intervention is to first determine what reasons are for the patients that refuse. This information will be gathered with pretest questionnaires that ask the patient to describe their reasons and also their likelihood for accepting LAI. Anticipated reasons include concerns regarding effectiveness, side effects, pain, and convenience. These reasons and other reasons that the patient expresses will be discussed in 3 education sessions delivered in the patient's home. Hopefully, a better understanding of LAI, the benefits of getting an injection in their home every 2 weeks or even once a month versus taking an oral medication at least once a day, if not more, along with the other benefits of LAI, results in a reduced refusal rate. The cost of the intervention is negligible. As the nurse, I already provide frequent medication education to these individuals. Most are seen by me at least every 2 weeks. In the past, the discussion about LAI has been primarily during their checkup appointments with the prescriber. Taking more time to talk about LAI and to provide education can make a difference. Evidence shows in other areas of healthcare that increased education increases positive outcomes. This concept is applied to the LAI education. Thank you for taking the time to learn more about LAI, ACT clients, and my education plan. These clients are amazingly brave, and they struggle every day to cling to their new independence. Increasing their acceptance of LAI will add to their ability to stay healthy and independent.